Hello, everybody, and welcome to another episode of Beyond Talking Points with Matt and Matt. Um, there was a while back we did two episodes on coronavirus, and I think we promised we were going to do a third one because I kept putting off research on the topic, and we are going to do a third episode, which is what this is. But it's going to be a little different because originally what we thought we were going to do was because we did like a close to 3 hour episode a while back where Matt like laid out all the research as to related to his take on all of this. And basically we thought we should do is okay, I should basically do the same thing. We're not going to be doing an episode quite like that. Instead, what we're going to be doing is we both found that our I guess the way we frame the conversation about COVID has shifted. So we're going to just kind of talk about how we've reframed it in our mind, how that's been related to the facts on the ground and how that relates to policies we advocate. And we're even also, I think, going to touch a little bit on sort of how far you can go with policy and how Machiavellian you can be versus, how much you have to follow the letter of the law. So it'll be an interesting conversation, I think. But I guess to get started, I hate admitting that I'm wrong. So I'm not going to admit that I was wrong. But what I'm going to say is I think my views have become more libertarian on the matter. So what you hear on the news nowadays, of course, and I was just listening to earlier today to the podcast version of Morning Joe, which is a news show on MSNBC. And of course, turn it on. First thing I hear is, hysteria about, okay, COVID cases are rising. This is horrible. This is crazy. What are we going to do? And they interviewed a doctor. What are we going to do, doctor? And I've sort of been having this. I've been consuming more mainstream media than I was at one point, so I don't know if like my thoughts on COVID have like were different in the beginning than they are now because I was paying less attention to how the mainstream media was talking about it. I think there's definitely something to that because if you look at the data, there has been a rise in cases. That's true. But a lot of the cases, from what I understand, are young people. So because what happened is, of course, people, society sort of went back to normal. People stopped wearing masks. People started going to bars and restaurants again. Started getting closer. It started social distancing less. And so what happens is more and more young people are getting COVID. But actually, if you look at the stats, so I have this from, let's see, where is it? I think it's under a study, Children and COVID-19 State Data Report, Summary of Publicly Reported Data from 49 states, North Carolina, D.C., PR, I don't know what that is, and GU. I don't know what that is either, actually. But I just wanted to read off a little bit of like the deaths by age, just so you have a good like understanding of what's going on here. And this is basically the deaths from the beginning of the pandemic until now. I think it was like around August 4th or so when this data was recorded. 0 to 17, it's like 349 deaths. 18 to 29, 2,519 deaths. 30 to 39, 7,218 deaths. 40 to 49, 19,163 deaths. 50 to 64, 96,997 deaths. 65 to 74, 135,308 deaths. 75 to 84, 165,721 deaths. And then 85 and over, 179,114 deaths. Now, unfortunately, I didn't remember to get the number of cases that are we have at the moment, but I think you can map on. I think you can look at those numbers and then look at the cases, and it doesn't mean there's increased deaths. Um, and also, I guess I don't mean to go into a rant. I guess you can jump in anytime you'd like to here, but um, the vaccines. I mean, this is of course it's a political pudgel now. Like, should you get a vaccine? Should it be mandated? Blah 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 blah. Which we'll get into all that. But if you look at the numbers, it does look like the vaccines work. It does look like if you do get COVID, and you can get COVID if you've been vaccinated, actually. But what happens is you get a very, very mild case. Like your risk of hospitalization and death if you get the vaccine, slim to none. It's not going to happen. It might, very small, very small chance, but effectively, it's not going to happen. So what they call the pandemic of the unvaccinated, I think, is probably a good description, because it's really the people who haven't been vaccinated who are getting hurt the most, being hospitalized, dying. So I guess I'll let Matt jump in here, but I guess I'll just add quickly, because I sort of threw a lot at the audience and threw a lot at you. I'm not a medical expert, not a researcher in virology or epidemiology. And I'm going to get into kind of like how the citizen, later on into the podcast, how the citizen, how a layperson kind of deals with this information, and how a layperson makes health decisions or thinks about public health when they're not really qualified to do so. But I do want to make that clear. Don't trust me necessarily. Don't come to me for health advice. Don't listen to this podcast for health advice. All obvious, but I do think it should be something I throw out there.
Yeah, I'm not going to qualify my thoughts in the same way you are, but a lot of the reason why I don't want to is for the same reasons why I kind of flip my opinion a little bit. So I know you said you're coming to a little bit more of a libertarian view on COVID. And I would just note that, like, for myself, I would separate the libertarian stance on COVID into a few camps. So, like, there is one camp that typically thinks government policies are they're constantly bad, but they're misguided. And some people think they're more malicious or done for another purpose. I'm not one to only criticize the. I'm sorry. I'm having a little bit of tech issues right now. Okay, I want to criticize them in the sense that it's obvious a lot of their policies haven't done what they planned for them to do. But I think I would go a step beyond and say the way they've disseminated data to the general public is beyond misleading, if not worse for people as a whole. So you rattled off a lot of numbers during your little intro monologue. But what you're getting at is this idea that deaths are not evenly distributed among the population. Most deaths are following in people who are over 80. A lot of people who are over 70 to 80 are still at risk, and 60 to 70 are at risk, but it rapidly increases the older you get. And we're not talking, we're 20-year-olds talking. It's not 40-year-olds are old. No, we're talking about people who are 70 plus. This isn't how COVID is talked about in the general public. It just isn't. So if you throw on mainstream news, it's about why everybody needs to be wearing a mask, everybody needs to be taking precautions, and it doesn't acknowledge the fact that the risk factors are not distributed evenly. And like this is one of the most like instrumentally obvious things about coronavirus. Like I was talking to you about in Pennsylvania, how few deaths are in people our age. And in ages 20 to 29, there have been 54 deaths and over 217,000 cases. So of the people, and this is only reported cases, people make the claim that deaths are understated. But if anything, people getting mild cases of COVID where they're not going to the doctor or even getting tested are going to be drastically understated. So I think the denominator is probably low. And that still leads to above a 99.9% survival rate. It's like 99.98, something like that. Well, I guess that's below 99.9. But well, no, it is above. Yeah, 99.98 survival rate for people like me. So the fact that all this policy has taken place and we're looking back at it and how everything was shut down and how we're not honing in on, hey, some people are tragically affected by this and other people are virtually, it's no more than a minor to moderate illness, maybe. Like that should be the headline. That should be the information that is a guiding principle for everybody to act. And that's not the case. And that's like a absolute travesty of giving people information to act accordingly. So the way I look at it is it's hard to imagine that that's accidental. And I'm not trying to say that they want people I'm not trying to say they have a malicious agenda, like they're inherently evil, but I don't think they're not saying the obvious on purpose. Like, I think that they want everybody to be acting as if they are at risk, even though they know the risk isn't even. Now, there could be a lot of reasons for that, but the point is they aren't telling you the full story. And that's misleading, and it's kind of a little bit that you could apply to a lot more than just public health. I think this applies to pretty much everything that gets covered in the news. They don't tell you the whole story. They choose how they want to present it. And COVID is a very obvious example if you look at the data that the government will even provide you. Like, it's just clear. And I mentioned to Matt before we start recording that Philadelphia is going back to indoor mask mandates. But even if you pull up the rolling 7-day death count in Pennsylvania right now, it's like 7. So it's on average over the last 7 days, 7 people are dying on average. And that's actually lower than it was, a month ago. But a month ago, we didn't have mask mandates. So it's kind of arbitrary, and they aren't giving you guidelines of how they're making decisions at all. They're just kind of telling you in ways that present data in a certain way and expecting you to not look into it. And I find that like disheartening and gross. So that's kind of where I'm feeling more so than this is bad policy. It's like these people are acting in a way that is evil.
Yeah, no, actually, as is so rare on this show nowadays, I think I have to. I think I'm forced to agree with you. I think logic forces me to come to a position very similar, if not basically the same as yours. Because what I realize is, again, we're just lay people here. But sort of what happened was, or what I realized was happening. What I realized for myself was, I was just going along with what I heard in the news, or I was just going along with what schools, okay, mask mandates, Zoom classes, etc. Like I didn't think about, I didn't really think about it, right? I didn't really put on my critical thinking hat, and really like listen to as much information as I could to kind of come to my own consensus on it. I mean, I think there are times for modesty. There are times when, we did a whole episode on like trusting experts, right? So, and I am one of the few people who will say, I don't think you should trust me on something. But I am sort of disappointed in myself, or not disappointed, but if I were to go back, I would not take certain things for granted like I did. Because I was sort of, I think I was just, focused on my own personal life, wasn't really thinking much about like these questions on a grand scale that we're talking about here. And so I just did what I was told. But that's what most people did. Now, that's not like, I'm not like, the outlier here. I'm in the majority. That's just what the majority of people did. And that's kind of what you expect to do in those situations. I mean, in the early days, I guess I will say, I'll add this other caveat. I think there were still some. It's not so much that we didn't know that the coronavirus was most deadly for people with diabetes or obesity or asthma, or people in 75. I think it's around the 50s or so when the deaths start to go higher than 60s, 70s, 80s. Of course, it just keeps going up and up and up. I think we knew a lot of this then. I guess the question, sort of in my mind, at least at the time, was, well, even if I don't get it, if I pass it on to my 86-year-old grandfather, or if I pass it on to this person or that person, there's like I think it's a little murky at that point. But at the same time, I still have to say that I trusted people who really shouldn't have been trusted, or I was more accepting of both the government and the experts that were working with the government than was warranted. Like part of this, and actually I realized this at the beginning of the pandemic. Like, people kind of forget about the mask mandate thing. Well, I don't know if they forget about it, but like originally you weren't supposed to wear masks, right? Because of course they were worried, like, okay, healthcare workers have to have enough masks. So I remember people hearing, or I remember people saying like, "Don't wear a mask, Matthew. Like, it's not going to protect you. Like, it's this person, this expert here said this." Actually, I can pull up a quick quote again if I may. This was a video. COVID-19, Johns Hopkins University experts discuss novel coronavirus, and this was published in March 2nd of 2020, so it's very, very old. But it's like the expert, I think it was Dr. Tara Kirk-Sell, a senior scholar at the Johns Hopkins Center for Health Security. She said, quote, a surgical mask is not going to be protective against coronavirus because the air can get through from the side. And I also, there was the first person I really heard talk about coronavirus like very in depth was Dr. Michael Osterholm. He was on Joe Rogan's show, and I actually saw him on, I think it was a PBS show, Ammon and Co. Public Affairs show on PBS. He was interviewed by the biographer Walter Isaacson, and he said, quote, this was recently actually, this was like a couple days ago, quote, I've had concerns, and it dated back to April in 2020 about the concept of masking. Needless to say, it is a political hot button before anything I've ever seen in public health, and yet at the same time, I think we've all done disservice to the public when you actually look at face covering cloths, those cloth pieces that hang on your face. They actually only have a very limited impact on the amount of virus that you inhale in or exhale out. And in fact, studies that have been done show that an individual might get infected within 15 minutes in a room by time and concentration of the virus in the room. If you add a face covering on, you can only get about 5 more minutes of protection. On the other hand, if you use a N95 respirator and you fit them tightly on the face, you can actually spend 25 hours in that same room and still be protected. Now, I'm not here to tell anyone listening to this podcast, okay, like immediately, believe those particular sources. But I am bringing them up because there has been a lot of contradictory information, and the experts, I don't think, have explained if there's a rational explanation for the contradictory information. They haven't elaborated. They haven't shown why they've given in contradictory information, really. And often, what I've seen is I think they've given contradictory information for irrational reasons.
Well, and I think that this all kind of ties into a bigger topic that I think we're going to touch on in a couple future episodes that we're planning on doing. But it kind of shows that I don't think there's as much accountability in democracy that people who are proponents of democracy like to kind of imagine there is. And I guess when I say that, I think about all the different policies that come into play that are kind of blank checks to local regimes. I use my local area as an example a lot. I think a lot of people who live in any in any democratic region probably could relate to this, where certain requirements or mandates will be put into place, and they don't really give any parameters for when it would be acceptable for them to no longer be in place. So it'll kind of say, we are concerned about the Delta variant, therefore we're going to do X. It is not followed by, like, here are valid causes, or here are other valid things as a result of the Delta variant that we're scared of. And once it gets back to the level of a month ago, we'll be happy. It's never really framed in that concept. It's just kind of a blank check, and then they can just kind of do things how they see it fit. And that's how the second mask mandates were here, or it was there was like an original opening where things became open and not everything was shut down. But then that's how they kind of like randomly went from 50% to 75% occupancy in restaurants. And they kind of randomly went from 75 to 100 and then being allowed to open movie theaters again. It was all fairly arbitrary. And I find that like very disheartening because it wasn't based on clear data. And to take that a step further, and this is something I just bring up because I guess part of the theme of what you're getting at is it's okay to defer to experts if you're not going to really research something. But you need to be cautious when you defer to experts. It's better if you research something, but sometimes it makes sense to defer. But I don't want to sound too out of place, but the data on COVID, you have to make some arguments based on, but the data itself is like painfully unclear, and hard to trust. So what do I mean when I say that? You imagine you're in you imagine you're a sophomore in high school, you're in a chemistry class, and you do these dumb little experiments your teacher concocts, and she knows exactly how they're going to play out and all that. So you heat up something to a certain temperature, and you know this reaction is going to happen. You describe it. It's very fixed settings. They tell you exactly what to do. Here's the thing with COVID. You have a college in some random zip code, and that college might require students get tested every week for COVID. But for some reason, a locality will decide to use positivity rates on tests to make policy. But if one zip code has a college and one doesn't, the college is going to be testing people whether they have symptoms or not. In every other region that doesn't have a college, they're only going to test people if they go in to get a test because they have symptoms. So these positivity rates can easily mean nothing if you have if you have a population in a certain region that's like, say, testing people when they don't have symptoms because that's protocol. But so all these like random areas are not apples to oranges, and then they're all brought together and used to make policy. And it's like, well, positivity rate has gone down 3% month over month. And it's like, yeah, does that even mean anything? Who knows? Now that everybody's vaccinated, I think, at least initially, people were less likely to go get tested for COVID if they had symptoms because they thought, I probably just have a cold. If the vaccine is working the way people say it's working, which I'm not one to doubt, then people are supposed to have more mild symptoms if they get COVID, which means they might think they have a cold, which means they might not be going to get COVID tests. So it's like maybe there's less positive cases because testing has changed. And then this goes to the whole debate on PCR tests, right? And if not all labs are testing, I guess a quick way to explain PCR tests, it's a test they use to see if you have COVID. They take a sample and they run it through a PCR machine, but you can cycle things at different rates. There isn't really an industry standard. There's a lot of debate over how, what cycle threshold you should use to actually see if somebody has a high enough viral load to actually really have COVID. If you set it to a certain cycle level, a lot of people will test positive, even if they're asymptomatic and not contagious. So it's like, what do these positive cases even really mean? So that actually means that would cut against me to mean COVID might be deadlier if more cases aren't actually cases. We don't know, right? And that's because the data is crap. And nobody's talking about how the data is crap. And that's like, to me, as a person who is a libertarian, therefore autistic, this is very frustrating to me. I'm like, all these decisions are allegedly made on data, which they're often not actually made on. And then this data is murky at best, even though there is trends you and I can suss out, like how old people are obviously dying more likely. But a lot of stuff is unclear because nobody cares about making decisions that are based on real things. It's about agendas and it's about feelings. That really drives me nuts. So yeah, I definitely need to get that spiel into this episode at some point.
Well, actually, I want to clarify something quickly. So when we're talking about experts, or when I say if I say follow the experts, I guess my frustration at the moment sort of comes from a place where that's what I was doing, basically, without really thinking much about it. I was just like, okay, this is what the experts are saying to me about this pandemic. I'm going to do what they say. And then when I actually do my own research, I start to, some of what they say, not all of it, but some of what they say starts to fall apart. And so what sort of alarms me is what do you do then? What does someone like me do? Again, I'm not a doctor. I'm not a medical researcher. I don't study these things for a living. But public health, first off, my own health, my health of my friends, my family, and just public health in general. These are important. It's like probably one of the most important like matters ever, really. I mean, if you don't have your health, you don't have anything. And if there are diseases that are rampant in your society, then that's going to come at a cost and all other, problems. So, I'm deeply interested in, I'm deeply concerned with public health. But if the experts are either not trustworthy or they're not kind of extending their hand to explain to you why they're trustworthy, if they're either malicious or they're incompetent, and I'm actually not, you said they were malicious, I'm a little more agnostic on that, but whatever the issue is, that the proper, we're not having the proper conversations and the proper information isn't getting across to the public, um, what do you do? Um, how do you solve public health problems? How do you think about health if a lot of what you're getting is crap? But I think a part of it, though, actually, of course, we've thrown around that word experts a lot in this episode so far. Part of it, I think, actually, and I mentioned this, I was actually rewatching a bit of like the very first episode we did on COVID. And I'm going to reiterate a point I made in that episode. Part of it is the media. Part of it is like it's not necessarily like, oh, these evil virologists and epidemiologists are trying to take over the world and ruin our lives, right? Part of it is journalists and media personalities. They come across some study on Google. Oh, that's going on my show today. They're also not experts. They also don't really know what they're talking about, just like you or I, in this sense. And so, of course, the media is the kind of people's primary source of information. Fox or MSNBC or nowadays, of course, it's YouTubers and alternative media. But mainly, it's the mainstream media I'm criticizing here. The mainstream media is kind of throwing a lot of this information at people without giving the proper context, without helping, without showing like maybe contradictory studies, or without like telling people to maybe take this study with a grain of salt, which is what you have to do, right? If you're a scientist, if you're thinking in this manner or studying these issues on that basis, you have to be skeptical. You have to look at multiple studies. Of course, you have to run multiple tests and experiments. And it is true that like your ideas are going to like be or tweak over time or change. But that's not been really that hasn't come across. And that, again, that's partly the media, partly failure of school systems, but people just really don't know how to think scientifically. And I think that's led to both the sensationalism in the media and then led to people acting upon that sensationalism. It's like the example I like to give. It was actually an example I saw on a John Oliver episode. He was like, it was a quote. It was like a clip from the Today Show on NBC, and it was like Al Roker. Everyone loves Al Roker, right? And Al Roker just said some offhanded comment. He was actually talking about diet, I think, or nutrition. And he was just like, just take whatever study you want, whatever study you like, just go with that. And I remember seeing that clip, and I was like, that's not how science works, Al. No, you don't just take that study that you like. that is totally anti-scientific. So that's I guess a rant that I needed to get out of my system.
Well, I think what you laid out there though is when you hear the common term from people in the media that say trust the experts, it shows that they've completely co-opted the credibility of people who should be medical experts, and then they shape whatever they say in the way that fits whatever they want most conveniently. So it's almost like I'm criticizing experts because I'm critiquing the portrayal of experts, and the portrayal of experts is a tool of the media and politicians to try to give their agenda credibility. I think that's the way I try to summarize it. And I think the reason why there's so much hate towards like Anthony Fauci is because he's a person who does have medical credentials, and he has, in a very public way, flip-flopped on a lot of issues, right? So, I mean, I know you mentioned earlier that it was initially don't buy masks because they were doing a noble lie, so we wouldn't crowd out, the supply of masks. And then there's kind of like, okay, now everybody needs to mask, everybody needs to double mask. And then it's like, how effective are they really? Well, if you draw that into question, then we're going to get a strike on YouTube, right? It's that kind of thing. So all of this every position on that has been taken by Anthony Fauci to serve a different agenda, depending on what was more convenient for whatever is going on in the public, right? So I think the real enlightening thing is it's not to necessarily critique the actual people who are professionals in the field, but it's more to say everything is viable to be co-opted by the powers that be. And it's to give a quick example, it's like if somebody says, I want to adopt a puppy, you can shape a narrative very easily on why they should or shouldn't. And it's not very hard. And it's because everything has trade-offs. You can say that puppy is going to be very cute. It's going to be adorable. You're going to love it. And you just love having a dog around, and maybe your life's hard and you'll be happy seeing it. And it's like, but also you don't know how that puppy's going to act. It might destroy all your stuff. You might come home every day and have to pick up, dog poop in your living room. You might have to get a cage for it, and then it's going to scratch up your door. You might have to take to the vet and spend like $1,000 unexpectedly. And it's really easy to shape a narrative by omitting half the story. And if you watch mainstream corporate press, they never give you both sides. They give you the half that fits whatever they're trying to push that week. And sometimes it's consistent, sometimes it's not, and it's because they don't really care. So that's, I think, the real takeaway for me, at least, from everything that's happened in the last year and a half.
Yeah, no, I'm actually glad you were, I guess, making a distinction between, I guess, actual experts than just the media's idea of like trust the experts, right? Because so when I was like, okay, at the beginning when I said I'm not a doctor, I'm not a virologist, don't trust me. I only say that, like, I'm not trying to say that in some like moment of faux modesty, or some moment of like intense self-deprecation. What I'm really trying to say is, if you look at COVID, a lot of COVID stuff, which is what I've been doing for about a week or so, and that's only a week's worth of study, so it's like there's so much more out there. It would take me months and months to really sort through a good chunk of it. But what I found was so much contradictory information that I was having it was truly bothersome, because I didn't really quite know how to make heads or tails of a lot of it. I mean, again, I can make an educated guess on various things, and policy is. I think I can defend my policy positions now based on the data and based on the information that I got. But there's a kind of conversation that the actual experts have to have about certain things that I'm just not able to have, or I wouldn't be able to really understand them in the way that they can understand each other. The example that I saw a video yesterday evening. It was a very short video of Brett Weinstein on his podcast, and he was interviewing these two guys. One was like an engineer, I think, and the other was someone who studied I guess a geneticist, I think. And he was making the argument, or they were both making the argument, that basically these vaccines are cytotoxic. Cytotoxic means that they cause cell damage. Now, I'm not able. Brett Weinstein's an actual PhD. He has a PhD in evolutionary biology, right? So he could like mop the floor with me and with his understanding of biology, and I would make me look like a complete fool, right? It's like those are the. But then I can also I saw I think it was Reuters was like critiquing his article, explaining why, according to other experts, or because I don't think Weinstein's actually a virologist or epidemiologist, but according to other people, they actually his argument and the argument his guests were making actually aren't scientifically valid for various reasons. I mean, it's my non-scientific opinion that I really, really doubt they're cytotoxic, based on just the fact that so many people have gotten the vaccine, and I haven't really seen the information to establish that charge. But again, it's like, if you care about public health, if you're just an average person and you care about public health, what do you do with all this conflicting information and misinformation that you're bombarded with on a daily basis? Excuse me. How do you distinguish between misinformation and actual information? It's very, very hard. So we really should. I need to, I guess, think differently maybe about our relationship to public health, because I think like there could be public health crises in the future that are worse than COVID, say, and you have the same problem of like, what information? How do you get the proper information? What information do you trust? Whom do you trust? And I think most people are dead in the water. I don't think most people can handle it. I don't even think I can handle it, and I like to think of myself as a fairly intelligent person. So, in the long run, actually, it might be better to not do what I do and just bombard yourself with information, because then you just kind of get in this little skeptical rabbit hole of like, how do you know anything? Which thankfully the experts go beyond that skeptical rabbit hole of how they know everything. But it can be hard for the layperson to do so, given they don't have that background, and they don't have that training.
I think I'm going to take a slightly different tact, I guess a little bit at least. So one thing that I just want to lay on it, and then I'll get to most of what you said, is trusting health experts on health is important, but the whole So a lot of public health experts I wouldn't necessarily say are to be trusted. And that's mostly just because it's like how I mentioned I've been I think I mentioned this on a few podcasts how I've been really interested in China-US relations, and I'll read a book and like 85% of it's just good information, and it's like some little bit of argumentation for however they perceive it based on a lot of evidence. Then the last 15% of the book is then they process their argument into like their bad policy making apparatus that is based on establishment policies that I think all fail. And then they think if we apply these base facts to the model that we've historically used, here's what you get. And in my estimation, everything they suggest is then bad policy. That's how I see a lot of public health. So you can know a lot about COVID, about how it's transmitted, about how you can limit that, maybe who is most susceptible in your in-groups, so maybe you don't want to be a risk of transmitting it to them. These are all things that would be good to know and you could get from health experts. With that said, when they make policy recommendations, it's usually very narrow-sighted because it comes from the lens of how do we minimize cases or how do we minimize deaths? And that ignores in reality how any policy making happens, because we could say, how do we minimize car deaths tomorrow? And it's by banning cars. And it's like, that's obviously not the optimal decision, isn't to ban cars. It's to do things that minimize it, but yet we still like the benefit of cars. So we still like the benefits of humans interacting in the physical realm. But if we completely eliminated that, then COVID would not be able to transmit from person to person because people would not inhabit the same physical realm. So obviously you can't actually do things with the goal of maximizing cases and deaths. Minimizing cases and deaths. A lot of policy health prescriptions have been narrow-sighted in that respect, and I don't necessarily think they should be trusted for the same reason a lot of economists can't be trusted, because a lot of economists suggest things that are narrow-sighted and bad. And those people are, PhD trained economists. So I wouldn't be surprised, like, public health is a social science and a science. You should listen to what they have to say about the actual science that maybe you and I can't grasp. But the social science things, I think, is like, okay, given this information, how do we apply it to policy? And that's actually something I'm pretty comfortable with.
I think I agree with you, though. I guess
okay.
I need you to clarify if you think there's a disagreement where we're disagreeing, because
I don't think I'm disagreeing. I'm just clarifying. I just want to, because I don't want to say trust the medical experts and people to think trust the public health experts, because I think they're social science experts, and I don't think social science experts generally are that good. I think So that's the point I'm trying to stake out. Okay, so now you were kind of bringing up how do I, as a random layperson, taking all this information, how do I act? Well, I think there's some pretty basic information that makes it pretty easy for a lot of people. And that's by how I sent over to you earlier. Like, I live in Pennsylvania, so I looked at the Pennsylvania cases by age group and deaths by age group. And it's pretty obvious to me who is most afflicted by COVID at what age ranges. And I think that should pretty drastically shape how you feel about COVID. Much like things that have been around for a while, like pneumonia, if you're obese or have other pre-existing conditions, you're going to be much more at risk for COVID, just like you are things like pneumonia. But if you don't have any of those risks and you're in certain age ranges, there really isn't any reason for you personally to be concerned. And you could be very, very risk intolerant and look at the numbers and then still think, yeah, why have I been so concerned about this? Now, that's not to say that you could be more cautious than me or what I would suspect the average person is. That's your prerogative. Be as cautious as you want to be. But I don't think I think the whole reason why I get so fed up and frustrated is the data is very skewed. It's not just that it's kind of skewed. Like, it is like exponentially worse for old people than it is young people. Like, to an obscene degree, if you haven't been shown the numbers, it would probably shock people. So, like, as a person who's in my 20s, it seems fairly obvious to me that I should not let COVID dictate any real action I take in my life, any more so than I would a minor virus. Now, I don't even think that's controversial to say. So as much as people like to hedge back, I think for a lot of people, it is pretty obvious. Now, if you're in a category of, say, 50-year-olds, and maybe you're not in the best shape, then maybe there are things you should do to take slightly more caution than I would. But if you're 80, then obviously it kills people like you the most. If you're really, really heavy, it kills more people like you than other people. These are obvious, they're not controversial, and they should be guiding factors. I don't think it's that hard. If you know more, it helps on the margins, but it's pretty straightforward, I would say. I mean, I don't need to know how certain things interact with parts of my body to know like the very obvious statistical truths. So that's why I kind of don't want to hedge what I'm saying as much as you are, because it's like, no, a lot of this stuff is in your face. They just aren't telling you that it's as obvious as it is.
Well, no, I think it's just a difference of emphasis. I don't think it's a difference of disagreement then, because I, I guess I'm making a really broader point. I'm not even really talking about COVID. I'm saying, given the amount of information on the internet, I think it can be very challenging when we're talking about health information. It can be very challenging to sort through it all and to make a well-informed decisions. And then, of course, when you get to how that relates to policy, then it gets even more infinitely confusing and tricky. But no, I mean, I don't think anything you said there was particularly controversial at all. And I think, and the reason I say I'm becoming more libertarian on this issue is for the reason that I'm not for the mask mandates at the very least for vaccinated people. I don't think you should. If you're vaccinated, then if you're going to get it, it's very, very unlikely you're going to get sick or die or get hospitalized. So there's really no reason for that. There's certainly no reason to really go back for any more lockdowns. That should be a thing of the past. Again, it just all goes back to looking at the numbers, which is not something I did in the beginning. And in fact, I was even more alarmed. You're gonna think I'm a silly person for this, but I was more alarmed in my own case, or for my own sake, than I ever should have been. Until I looked at the numbers and realized, oh wait, there's no reason for me to be alarmed at all. I mean, and I think part of that is, part of it is, I think, just the way American politics works, like in my view. So I just don't think I'm going to say something, and I think we've had a long-standing disagreement on this, but I'm going to say it anyway to make a point. So I think other countries have a more cozy relationship with their government. That doesn't mean there aren't people in other countries who hate their government, who aren't anarchists, who won't want the government to interfere in business affairs or whatnot. Those people exist everywhere, right? But like, if you go to the UK, right, look at the Tory party. Tory party is to the left of the Republican Party significantly. So it's like, Europeans particularly, I think a lot of them, they don't have they don't have as much of an antagonistic relationship in their heads with the government. That might not translate into action, right? They might still pay their taxes, they might still vote, but I think Americans feel like they are the government is sort of against them, or it's them versus the government. I think other Europeans are a little more like, oh, the government's kind of there for me. The government's kind of my friend. They're kind of my pal. And they're more willing to accept paternalist policy on that basis. Paternalist policy, I mean, it exists in America, but I think people in America are far more resentful of it. So it's partly for that reason. Again, it's also for the fact that, well, if you're vaccinated, you're not going to die. So it's like, or you're almost certainly never going to die. So, or not going to die from COVID. So there's a numerical reason, but there's also that reason of like, yeah, I don't think people are going to go for these paternalistic policies related to COVID anymore. I think that kind of ship has sailed. I think people are getting fed up and kind of giving up on a lot of this stuff. So even if I were in theory in favor of these, of kind of going back to how it was last year, I think that I would have lost that side has lost the kind of the PR game. So yeah, I don't think it would work at this point.
Okay, well, this is, so it took us 45 minutes to get to the more contentious things, but now I have a lot to push back on. So maybe we'll go point by point. Okay, so overall, U.S. might inherently have a more antagonistic relationship with their government, but I will note that there has not been the types of anti-lockdown rioting that we've seen in certain European countries over the last few months, and anti-vaccine like mandate rioting. Germany and France are for sure two countries that have had huge like riots that were essentially anti-vaccine mandates, and there hasn't been anything on a similar scale in all of the U.S. in the last few months. So I think that is worth noting. So that's the first thing I want to lay out. I guess that's more of a specific issue thing, but yeah. And if you want to respond to that, or I think we can move on.
No, I would just say most Frenchmen are not in those that are protest. For example, most Frenchmen or most people in France aren't in the ones protesting, but there is a loud vocal minority that are protesting the lockdowns in France. Yes.
Okay.
But that's just because the political landscape in a country like France is actually different. Than it's a little different than it is here. Like there's a little more people on the fringe right, say, there than there is here. People like Marie Le Pen and the rest. So it's like I expect those far right fringe people in France to protest these things. That's sort of like I would script that, and that's what they do. So that doesn't really surprise me at all or invalidate my argument.
Well, okay, I would go on as well. Okay, so there was a throwaway line that I wanted to kind of push back on that you were saying, and it's not something that's uncommon to say. And I don't think it's incorrect. I just think it's it gives an incomplete picture and it has an implication that is wrong. And it doesn't. You don't have to necessarily defend the implication. I just want to spell out why it bothers me when people say it. It's just the phrase, if you're vaccinated, you're not going to die, has the implication that a lot of people in a lot of age groups were going to die if they weren't vaccinated. Right. And it's not that you're not saying that clearly, but we just went over how in age range 20 to 29 in Pennsylvania, only 54 people died over this like last, 18, 19 months from COVID. So like, it's pretty obvious to me that 20 to 29-year-olds don't die from COVID. And it doesn't really matter if they're vaccinated or not. I have a friend who had one of the vaccines. He got COVID. And I don't know if you saw like Lindsey Graham. He got COVID recently. And he said, well, I got COVID even though I'm vaccinated. But you should get vaccinated because COVID for me would have been worse if I wasn't vaccinated. But when you're talking about young people, this is kind of like an unfalsifiable premise. Like it's hard for me to imagine that my friend who got COVID and was actually like marginally sick for a week would have had it worse if he hadn't been vaccinated. Like it's kind of odd to, I guess, assume that. And I don't think there is really a reason to. But I guess what I'm getting at is even if he got a breakthrough infection, I'm not even trying to make a claim that you're more likely to get one if you've had a vaccine. I'm more trying to get at he was never in the population that's really at risk of dying unless he was an absolute fluke. He had no pre-existing conditions. So it's like, why would he be the rare person that age range to die from COVID? So it's kind of like when people say, well, vaccinated people are protected from COVID, unvaccinated people aren't. So unvaccinated people need to wear masks and we need proof of vaccinations. It's just kind of odd considering we just looked at the data and a ton of people who aren't in vulnerable groups were never in vulnerable groups, right? Whether they were vaccinated or not. They had a very low risk of really any severe reaction to COVID. The other thing I'd point out that goes along with it, which is kind of what makes me suspicious of the media narrative, is if you look at the vaccination rates, it's curved in the sense that the people who are most at risk of dying from COVID are the most likely to get vaccinated. Right? It's skewed the opposite way. So it's like the people who are already at most risk have already gotten the vaccine at the highest rate. So that's good. Like, I don't see why people are that upset about how only half of Americans are like fully vaccinated or like 40% or 60%. I don't really know. But I don't see why anybody should be upset about that because the most at-risk people got it if they want it. Right? Like the 80-year-olds, the 70-year-olds, the 60-year-olds. And then it's like the people who are 20s and 30s don't get it because they were never really at risk in the first place. So who really cares? Why does this need to be such a big issue? And that's kind of why it's like, why should we care? It seems pretty apparent that the people who this is supposed to help the most have gotten it a higher proportion. So I wanted to kind of hear your feedback to that.
I mean, I think the first point is just sort of a minor one I'm not terribly interested in. I mean, I guess I would just say that the Delta. I think you're right. I would just add the caveat that from what I've read and from the studies I've seen, the Delta variant is different than the original variant, and that is a little more deadly. Now, again, you're not likely if you're in our age range, early 20s, early late 20s, or you're not likely, very unlikely to get hospitalized or to die. Yes, but I guess I don't really. I don't really. I'm going to defend what I said because I just think that's a point of language which isn't particularly interesting to me. As for vaccinations, or as for people, the hype about that, I do think everyone, I think everyone that can get vaccinated should get vaccinated. Because, as I said, the vaccines obviously do work, and if that will just that will continue to minimize the deaths. Now, again, even though the cases are going up, there are the deaths are not as alarming because there's so many people are vaccinated, right? But if you do want to minimize deaths, and I do think that's a fine goal, and I mean that's a goal I expect from public health, then people who are able to get vaccinated should get vaccinated. Now, again, this is where the libertarian part of me comes out, and I'm saying I don't think you can force vaccinations. I don't think, and it's partly new. The vaccine is partly new. The vaccine's like completely new, right? Now, it does annoy me. I hear people say, "Oh, it's not. I'm not going to trust the vaccine because it's emergency use only." Again, I don't see that data to be so distrustful of the vaccine. Yes, it is emergency use only, and we need to acknowledge that. But I don't think that invalidates the use of the vaccine. But you can't. I don't because it's relatively new, and because there are a lot of people that are very suspicious of the vaccine. The pregnant women are one example. The African American community is pretty suspicious of it, from what I can tell. I actually think that mandating the vaccine would be counterproductive. It was that Dr. What was his name again? Dr. Ulsterholm. He said this in that PBS interview I mentioned earlier. He said, from what he's hearing from the vaccine, from the people who are, against getting the vaccine, or the vaccine hesitant, excuse me. I think he was talking about the vaccine hesitant. He was basically saying people who aren't going to get the vaccine, we can't do anything about what them. They're not going to get it at all costs. But the vaccine hesitant, it's like it's his opinion that if they make a vaccine if the government enforces a vaccine mandate, we've lost the vaccine hesitant people. They're just not going to do it, and because it's mandated, and because they don't trust the federal government for whatever reason. So it now I guess I say that, and when I say that, I have to add, though, to be entirely clear, I'm not against vaccine mandates in principle, because I do think we've eradicated so many diseases from vaccine mandates that I think it's foolish to say those are evil, tyrannical, authoritarian policies, which people are going to say, but I don't go along with that. For this one, because it's new, because COVID isn't likely to kill you, when you're in a certain age range, it's just not going to kill you in a certain age range. Then I don't think we can justify mandating the vaccine.
I just outhand, I reject that COVID is something that I should really care about on a personal level, which is kind of like a lot of my feelings stem from it, because I think there's a good faith case that a lot of people on their personal level, just like at risk at the degree they are at risk of the disease, it's so low that it's like, why should you require people to do things to this extent? And it just seems absurd. I will say, just to throw a little water on if the Delta variant is more deadly. I heard it was more contagious and not more deadly, but everything is kind of screwed in terms of data, in the sense that there have been more treatments for COVID over time. So how much can you compare how deadly a strain is? Like if COVID happened in 400 years ago, how deadly would it have been? Well, our medical system was much less advanced, right? So we didn't know how to treat things in general. So it's kind of hard, considering they've been treating COVID for a year, so they have better tactics. But I mentioned earlier that the rolling death rates for the 7-day average in Pennsylvania has actually decreased over the last month, even though they're doing more mandates in the city I live in. So it's like, I'm not sure if there's evidence there. I'm kind of interested in how the data always plays out, because it tends to validate a lot of my skepticism. So it's a self-serving reason, but that is an interesting point, and I'll see if the media interacts with that. Now, the bigger thing you got at, which I wanted to bring up, it was my next point that you kind of lead into there. I think that a lot of this is intended to be polarizing. So why do I say that? It's because it's presented in such a, I guess, misleading and dishonest way, and in such an overtly partisan way. This is why I was telling you a few weeks ago that I was listening to NPR, and there was a throwaway line that was like something along the lines of public health is not supposed to be political. And it's like, well, one, you're going to use levers of policy making, which are always political and are always polarized. So, like, of course it is going to be. Why would you think anything else? But the framing of everything has obviously been from one side and the other. Like, each side quickly took one view or the other, or at least to some extent. And for this reason, I don't think it's obvious that certain mandates aren't going to come back, depending on your jurisdiction. I mean, I mentioned that they're coming back here in Philly, and when I go on Twitter, I think the obvious reaction to this should be telling the mayor to kill himself or something, right? That's what I would do. But there are people who are responding. They're like, "Thank God, if we don't have a mask mandate, like I'm vaccinated, but we need a mask mandate now." Because it's been to the point where it's like this extreme caution has been taken as a partisan emblem of valor. It's like I'm a Christ figure. I've sacrificed my 20s to do better for society, and it's just a partisan validation technique at this point. And it's very hard to differentiate things that come from the public health apparatus that suggest more restrictions from like generic Democrat talking points at this point, because they're kind of the same thing. Then the Republicans say all these things I don't necessarily find interesting or sophisticated, but in my mind, at least they don't want more of what the left wants, or in terms of Democrats being the left and the Republicans being the right. So even though they say things that are absolutely absurd, it's like, well, obviously, I think the policies that the Democrats want are awful. So I have to side with the Republicans in terms of like if I had to pick one. But yeah, it's been polarized. Everything's a flashpoint, but that's how politics work. This is what it's designed to be. This is why I wouldn't write off any of the things we've talked about, because it's like, well, yeah, a bunch of people are fed up. And that's because that's how it is. That's how it's supposed to be once you inject these types of rules into a system. And it's not that I don't think it's justified or could be justified or isn't justified. It's just like, this is the way it works. And anybody who's acting surprised about it just does not understand the system of interacting between mainstream, political parties in the US. Like this was the inevitable consequence of it all. Like this is why people are having school board meetings where they vote out the whole school board because of mask mandates for kids. It's like all this is the cultural flashpoint. And this is the only issue anybody talks about now for the most part. For this reason, it's crowded out all the other discussion. And it's also been used, because it's so politicized, as a cheap way to shoehorn other bad policies, which I don't necessarily think it's like that's the whole reason why it's been politicized. But it's hard to not look at the trillions of dollars in spending authorized in the name of COVID and think like, well, they made COVID a flashpoint. They made everybody care about it and get fired up about it. Cool, we can spend trillions of dollars in stuff that's not COVID related. So I don't know. I think that's the intent. So just because people are fed up with it, it's like, yeah, they always were. I mean, I don't need to rely on personal anecdotes, but a lot of my family members have never cared for COVID or any regulations or restrictions for any second in the last year and a half. So I think that's just how it is.
Well, I'm also I am stationed here in good old Kentucky. So Kentucky's a red state. So maybe my sample size of people that I talk to is just too far in one direction. But actually, if I may go ahead and bring up, we were you sent me a text about two people, Joe Biden and Ron DeSantis. And you brought them up because, I mean, this ties into policy and the polarization aspect, or how these policies are controversial inherently. Because Joe Biden, of course, is he's trying to keep the eviction moratorium intact. He's trying to keep it going. And then Rick DeSantis is, saying there are not going to be any mask mandates for children in schools. And if any schools try to mandate masks for children, we are going to withhold your salaries. That's it. Now, I think I'm against both of what they're doing, but purely on the legal grounds. I think purely on the grounds that I think they're playing a game which they're really ultimately going to lose. So I think when you're a politician, and I've talked about this before. I think I'm always bringing up this phrase I came up with being the principled unprincipledness or something like that. And I think it was about I brought that up, or I came up with that expression when we were talking about the courts, like packing the courts, right? Um, I think when politicians are pushing policy, their wiggle room is with precedent. Their wiggle room really isn't with law unless that law is changed. And so if I were either of them, or if I were just a politician in general, and I were trying to pass some, legislation that I thought was important but was maybe a little bit controversial, I would be working. I mean, obviously, if it requires legislation, again, then you obviously hammer it home. You obviously do as much as you can. You go to board meetings, you scream at people, you threaten to pour money into their, the person who's going to run against them in the next election. You can play dirty in that sense, right? And I don't care. I mean, I think that's justified in politics, but when it comes to bucking law, like that's when you get into tricky territory. Now, the eviction moratorium, I mean, Crystal Ball from Breaking Points was talking about this a couple episodes ago, because I think the Democrats have basically known like this was going to happen for like 3 months roughly, and the courts they upheld the eviction moratorium. They're like, okay, guys, we know it's COVID, we know it's a difficult situation at the moment, so we're going to uphold this eviction moratorium, but you have to get legislation passed in the next couple of months. This isn't going to fly. We can't do this forever. And so he's just covering his derriere. He's just trying to do what is like, politically palatable for his constituency, because I think most people on the left would say, give money to both the tenants and the landlords, to subsidize them. So, before things, until things go back to normal, roughly. And so he just dropped the ball in a totally ridiculous way. He didn't have to. The Democrats didn't have to. They did. I hate them for it. This is the world we live in. I think the courts are going to strike this down. People are going to be, both tenants and landlords are going to have a very difficult time in that sense. And that's my piece said on that. And then, as you say, as you said in the text, for the mask mandates, generally counties and districts have been deciding these kinds of things. So I also think the courts will probably end up striking that down. Now, as for whether, as for asking the question whether kids should have mask mandates in school, I mean, that's where I guess I get a little trickier, or that's where I'm like a little more confused on the information, or I'm a little less willing to give an answer one way or the other, because I think I could make an argument that, well, until the kids get vaccinated, they could be spreading it to other people, so they should probably be wearing those masks. On the other hand, there could be some negative side effects to. I mean, I don't know how effective kids are wearing their masks, or I don't know. So I think there could be good arguments on both sides. I just haven't heard much about it and haven't thought much about it. I'm leaning on the side of no mask mandates. When it comes to children, I think it's a little trickier. If anyone wants to put forward arguments about that, for or against, they may do so, and I will listen to them with open ears.
So the Ron DeSantis, Joe Biden dichotomy I was laying out wasn't really meant to be, I guess, included in this conversation, because I think it goes to different territory. Although I do appreciate you at least teasing, maybe we'll talk about that more, because it does play into kind of inherent polarization, and there is a political tactic aspect to everything that's happened in terms of policy. I think there was something you just said that illustrates a better point that's more on topic that I do want to get at, since I feel like I almost got a softball. So what you just said about kids' mask mandates, I feel like epitomizes a lot of how the government has taken people who have good faith interpretations of what's going on and then co-opted it for whatever was convenient for them. So you're kind of saying, yeah, there can be an argument that's a little convincing for why kids should have it, like they might be a vector of transmission. They aren't vaccinated. But they're kids. Are they going to do it properly anyways? When something happens like this, I think the obvious answer is, yeah, so why is the government making any sort of decision? It should be along the lines of school by school, and the parents, luckily, would ideally have the position to choose if they were so upset by the decision to send their kid to a different school.
If you put a gun to my head and asked for a policy, I think that is the policy I would give. I was just acknowledging that I don't think it's I don't think it's necessarily black and white. But I think that is the policy that makes the most sense.
So when you say it's not necessarily black and white, I think that's the whole point. I guess I'm getting at is none of these things are black and white, and then they say therefore we're going to do a one size fits all policy. They like. So some people are more at risk of COVID than other people. Okay, we're going to shut down movie theaters because we don't want people getting COVID because it can really hurt old people and other people can still get sick. It's like, or we have the information we have and people can make their own decisions. It's that simple. We could have that world. We really can't have that world in the sense that our government will never allow that world to be the world. It is inherently run by paternalistic figures. But it's like all of these things are murky. So it would make sense if people could use their own tolerance of risk. I mean, I know a lot of people who are far more risk averse on the topic of COVID than I am. I think they don't know the data because they really haven't looked at the data. They're people who consume the corporate press. But that's aside the point. They can operate in that way, and it wouldn't affect me. And all is fair, and we're all good. But that just hasn't been any of the ways it's played out. It's played out as this is murky, so the government mandates the most conservative, risk-averse approach. And as you were talking about the eviction moratorium, the whole reason we have that is because we were given the top-down paternalistic situation. And the economy was top-down, shut down in most cities and states in the United States for months. And then people got laid off rapidly in any service sector. And I'm not saying people would have day one, oh, no mandate, I'm going to go get drinks at Buffalo Wild Wings and they'll hire back their whole staff. I'm not saying there would immediately be this demand increase. Demand could naturally go down without a paternalistic government. And people could still get laid off. But everything they've done with this top-down, one-size-fits-all stuff has exacerbated every problem. And it's all in the name of it's murky. And we want to be cautious, so one size fits all, and then in the risk-averse manner. That's disgusting. That should not be defensible. Like, it isn't fair to say there are okay points on both sides, therefore shove it down everybody's throat. Like, I don't think that is a way that policy can be made, and that's the way we take it for granted. And, like, that's the core heart of why libertarians tend to be disgusted with the ethos of government. And that's not even an anarchist thing. That's like the libertarian... Like the basic libertarian tenet is paternalism is bad. And that's what all this stuff can be chalked up to.
Well, yeah, so that's in the course of the pandemic, I think I have thought further. So yeah, I mean, everyone knows I'm kind of a, I guess, not liberal, but I'm a lefty of sorts, some kind of lefty, whatever lefty, I never know, but some lefty, I'll say. But I've always had these two strains in my thought, this a more libertarian strain and a more paternalistic strain in my thinking. And so the pandemic has really forced me to think more on whether you can have those two strains simultaneously in your mind. If you can, how? And if not, then which one has to give? I think that is a very legitimate question, actually. Again, I think Americans, I mean, like I said earlier, I think Americans are a little more likely to distrust paternalism, but there is still paternalism in our government. I mean, the drug war is the greatest example of paternalism, one of the greatest examples of paternalism in our history, because what are we saying? We're saying these drugs are bad for you. The government should prevent you from getting them so you don't hurt yourself. And what both liberals and libertarians agree on is that's stupid. If I want to, and if I want to use meth, if I want to use heroin, if I want to use cocaine, if I want to use marijuana, I should, and you can go away. It doesn't matter if it harms me. All that matters is I should have I should be able to do that. So, I mean, that's just an issue which I am grappling with in real time. I mean, we'll see where it goes. I mean, I'll say this. This might. I hope this doesn't send us down a rabbit hole, but it might end up sending us down a rabbit hole. I do think I do think I can defend the policies up until a point. I think I can defend them in the very beginning. I don't think I can defend them anymore. So that puts me in sort of a middle ground between these two camps: people who want it now, want it then and now, people who didn't want it anytime. And I'm sort of saying, no, I think because of the lack of protection pre-vaccine, we had to do some drastic measures, and then therefore we had to deal with those drastic measures through policies like eviction moratorium, etc. Now that we have the vaccine and people are able to get the vaccine, right? It should be pretty simple for anybody who wants to get the vaccine now to get the vaccine. I don't expect 100% of people to get the vaccine. You never expect 100 people to do anything. I hope more people do get the vaccine, though. If they don't, that is their prerogative, and I will let it go at this time. Or no, I mean, I think you have to let it go. And so I'm not for these policies anymore.
Yeah, I think that might be a can of worms that maybe we should tackle at a later date, because I thought we were probably getting ready to wrap this one up. Because I actually was kind of under the impression that you were willing to defend maybe the 2 weeks to slow the spread stuff. But I didn't realize you were willing to defend everything that was pre-vaccine. And I don't know if I'm misinterpreting you. So maybe if that is your feelings, maybe we do need to argue it out a little bit more, maybe at a later time. But yeah, I even when we came into this, we were planning on talking about how you thought more initial restrictions were okay. I thought you were really going to defend like the first month and not the first 6 or 9 months. So that's actually pretty shocking to me. But I don't think we should. I don't know if we should necessarily litigate it right now, unless you think we could do it in like 10 minutes.
I mean, I don't really want to give a time frame, but yeah, no, we probably shouldn't litigate it at this time, to be honest.
Okay, that's fine. Okay, well, I think we hit a good stopping point, and that might be a teaser for a future episode if we decide to look back and then maybe rehash a COVID part 4. But for now, I'm glad we were able to clarify our thoughts. I'm glad you were able to be I mean, I guess it was pretty humble of you to reach out to me as a co-host and say, hey, Matt, I want to do a 3rd episode on COVID, and then you come in and you're like, yeah, you were kind of right. And even if you don't fully agree, I'm satisfied a little bit that you're recognizing certain things, that it's some concessions that I guess are really hard to get out of other people, even though ultimately we still do disagree on a few fundamental points. But for now, you can find more of my content. I'm on Twitter at Matthew T. Keck. I know Matthew over here is on Twitter. God, I don't know your handle off the top of my head yet. I'll get it down some point. It's like Matthew Hazelwood, but it doesn't end with OD at the end of Wood. It's like a 3 instead. That's my guess. You can correct me if I'm wrong in a minute. You can find him on YouTube at The Anti-Philosopher. He also posts another podcast called The Philosopher's Guide to the Apocalypse. I host another podcast called The Obey Podcast. And we post here every week. So we've done almost 70 episodes, and we keep shooting out an hour of stuff. We've covered a wide range of topics. I know Matt mentioned that he cited something from an episode long ago, but we've covered some stuff that I think is pretty, like, I don't want to say timeless, because it's not like we're unique commentators in an eternal sense, but there are topics that aren't culture war stuff that we cover. It's not like you don't need to hear it the week it comes out. So you might want to just peruse the backlog, see if you want to think about Jordan Peterson, Sam Harris debates a little bit more, stuff like that. And we've done episodes on it. So definitely check that out. And you can find that on any and all podcatchers beyond Talking Points.
My Twitter handle is at Matthew Hazelwood WO8. So just cut off the OD, okay. Cut off the OD and add 8, and then you'll find.
And there you go. So for now, though, sign off is Matt. Thank you.